Exactly. It depends what you like. You get rejected, you work instead of having a cocktail.
Lavish ones. You know, some of the solutions.
Considered to be the oral, even though, you set up a neighborhood killed so easily. So that's very important.
Well, doctors prescribe medications to help people get better, whether it's a physical injury or a mental health issue. But sometimes the pills being given become addictive. From pain meds to sleeping pills, our next guest, Dr. David Buch, says the overuse of medications is becoming a huge problem. And thank you and welcome to Ebru Today. It's your first time here.
Thanks so much. It's my pleasure.
Well, let's talk about some of these different pills that have really become misused.
The first kind of medication is pain pills. Prescriptions for morphine-related pain medications have gone up dramatically in the last 20 years. As pain medicines are used increasingly for non-cancer pain, there are more and more medicines, Percocets, Vicodins, and related medications out in the community. Other medications that have increasing amounts in the community include tranquilizers, medicines like Xanax or Klonopin, sleeping medications, stimulant medications, medicines that are used for attention deficit disorder have been prescribed to a great deal more in the last decade, perhaps 9 times as many prescriptions since 10 years ago.
And I know a lot of the kids, and I say kids, a lot of the college kids are using things like Adderall and you said like the ADD medications.
Right, they're often using them not for attention deficit, but simply to help them with their study as a study aid. You just take something the night before your test and it helps you really focus.
And then also I know that they're mixing that with alcohol. So I want to talk about what for the to the body, what does the misuse of these, or the overuse, I should say, of these medications, what does it do to the body?
What it can do is it can impair your thinking, your judgment, and the combination, and the wrong combination, can even make people lose consciousness or stop breathing. That's where we're seeing the biggest threat, is people may take pain medications that are prescribed, and then they may take an extra pain pill or two because they want to rest tonight and want to get some sleep.
Sure.
Then take maybe a sleeping pill on top of it, maybe have a couple of beers to relax. The next thing we know, somebody might be in the emergency room. So there's an increasing problem with accidental overdoses.
And what about, like, say, long-term, like, say, to your liver or to your other vital organs?
In some ways, if people are taking these orally, there's not as much of a risk to your internal organs as if people inject, but some people do progress from oral medication to injecting medication, and then you can get like viral hepatitis and other infectious agents.
Well, how common is this problem, and who does it affect? I mean, are we talking about mainly college kids, or is it the whole spectrum?
It could be any age, really. Young kids in high school are experimenting. Many take their parents' medications. It's estimated that up to 10% of 12th graders are taking pain medications from their parents. We believe that it's about 1 in 20 people over the age of 12 have an issue with pain medication addiction. Many people just start with a legitimate reason for taking their pain medication, and then may find it makes them feel really good, and so they take extra, or they may take it to help them relax, or they may take it to help their mood, or they may start combining medications.
So what can be done? I mean, obviously, we're seeing a lot of misuse. What are you prescribing?
First thing would be a lot of care in prescribing medications. I think as physicians, we want to do no harm. We want to help people with their pain, but we sometimes assume that prescribing pain medications as if somebody had a terminal condition does not always work if somebody has back pain and they're going to have it for 20 years.
And very quickly, what signs of, if we think we suspect somebody might be addicted, what are some of the signs we might look for?
You'll see differences in people's behavior. You'll see people who take more and more medication even though they're not getting better. You see people giving up important activities in their life. You see people having financial problems. You see people calling out from work more. You see people doctor shopping.
And if you do think that somebody has a problem, what should you do?
If in doubt, talk to your doctor, or if you're not sure about your doctor, get a second opinion from somebody who knows about addiction. Doctors who are certified by ASAM, which is addiction certified physicians, If you're not sure, talk to a hospital that deals with addictions. The community groups like Al-Anon and Nar-Anon are extraordinarily helpful. Many people's churches or religious institutions have some helpful references. Addiction therapists can be very helpful. An addiction counselor can work with a family.
Well, Dr. David Buch, we thank you so much for being on Ebru today. Some wonderful advice, and we hope you come back.
Thank you so much.
Okay.